Are you one of the millions of Americans that suffer from back and neck pain? Have you been through treatments such as traditional chiropractic care, physical therapy, epidural injections, or even back surgery with little or no success? These treatments do not address fibrous adhesions. In order to offer long-term pain relief, the fibrous adhesions in the joint capsules, discs, and surrounding supportive tissues must be treated. MUA is a safe and proven treatment for chronic neck and back pain. The MUA procedure uses twilight sedation to relax restricted muscles, allowing the physicians to gently stretch and adjust the spine. The MUA physician is trained to recognize where and how much stretching and adjustments are needed for each patient.
My name is Dr. Scott Herman. I own and operate Tropical Chiropractic Group, which is on the corner of Sample and Lyons Road. Been there 12 years. It's a complete wellness center. And in that center, we actually do a procedure called manipulations under sedation or manipulation under anesthesia. And that is one of the few procedures where medicine and chiropractic actually bond together and get together for a sole purpose. And the sole purpose is to break up scar tissue and adhesions in more complicated cases that chiropractic or medicine can't achieve. But when they do get together with an anesthesiologist, an emergency care doctor, a chiropractor, and a nurse, which is a completely safe environment, the procedure is actually 30% manipulation and 70% stretching and breaking up scar tissue. Through gentle massage, we knead out the adhesions in the scar tissue that can't be done while they're not under sedation or anesthesia. So the ideal patient would be somebody that's non-responsive to traditional chiropractic care or medicine. People with bulging discs, herniated discs, that have severe pain due to scar tissue and adhesions, that aren't responding very well to normal procedures. They might have some biomechanical problems that they cannot handle unless they're under sedation.
Played football for 12 years and I got some lower back pain from tackling too many people. Been to different chiropractors. I went to discuss spinal decompression, but the problem with spinal decompression is that you're not really relaxed enough to actually get into the muscles in the spinal cord. So we discussed doing MUA, which would allow you under anesthesia to be relaxed enough to get into the muscle and the skeletal fibers.
The actual procedure itself takes 3 days. The patient's going to go under mild sedation for approximately 15 minutes on a Wednesday, Thursday, and a Friday morning. And they get prepped by the anesthesiologist and they get tested by the emergency doctor to make sure they're going to be fine. So it's a very safe procedure. I had somebody perform it on me. Because before I did it on anybody, I wanted to see if it was safe for me, and it was perfectly safe. The anesthesiologist is there the whole time.
The anesthesia is nothing to worry about. There's no, since you're not having surgery, there's nothing to recover from. They're not, you're not having as much as you would with a surgery, so you just kind of come right out of it. I went right to work and carried on my day.
I work along with the chiropractors as they perform their manipulation under anesthesia. What we do is, as the patient comes to the operating room, we sedate them with one medication. It's called propofol. Propofol is a very safe drug. It's used throughout the United States and pretty much all of Europe. It's an induction agent we use in every surgery. After we turn off the propofol and we stop giving the last dose, within 10-15 minutes the patient's usually awake. They're alert. It doesn't cause amnesia, so you're not groggy. You can go home the same day and you can carry on your normal daily routines.
My apprehension was more about the anesthesia than anything else, just because it was 3 days in a row, and it was a breeze. I had no problems at all, and I feel very comfortable now saying that I feel it's a safe procedure.
After the 3-day procedure is over, it's imperative that the patient goes through about 5 or 6 weeks of physical therapy. That physical therapy is going to make sure when the scar tissue and the adhesions are broken up that they heal properly and they don't intertwine in an irregular fashion. They basically heal properly. That takes about 5 or 6 weeks. After the physical therapy takes place, we usually, in my office, sometimes do a post-MRI to find out what's going on. We usually have over an 80% success rate. Not only does the patient feel better and have less pain, scar tissue and adhesions, but we've shown them on MRIs the positive biomechanical improvement by an MRI showing a herniation or a bulge before the treatment and it actually being alleviated after the physical therapy. In my particular office, I have 2 spinal decompression tables which are great for disc problems. And a lot of the patients after an MUA, they do spend about 5 weeks going through a pretty in-depth spinal decompression program which can alleviate some of the disc problems that they originally had. So that works hand in hand with the physical therapy after the MUA actually takes place. And there is about a 90% success rate when we incorporate the spinal decompression with the MUA.
After the procedure, I felt great. It was a great relief. It stretched out my back and my shoulders and my leg muscles. I had some very stiff calf and hamstring muscles because of the lower compression of my back, so it stretched that out as well and really got into making me feel more relaxed. There's less tension in those places.
I tell everyone about this procedure. I feel so great. I mean, when you're in pain, there's not a whole lot you can do. So your life stops in a lot of ways when you're being active. So I'm much more active now and just happy and comfortable.
I felt relief like right away. It felt better.
I would recommend it highly.
Only a physician that has been certified in MUA can perform this procedure. The results of the MUA include altering pain-producing scar tissue formations, decompression of bulging herniated discs, stretching of chronically tight muscles, and eliminating pain by improving range of motion of the affected joints. Here are some of the common conditions successfully treated with MUA.